everyone. Our topic today is about providing care as a total person. What does it mean to me? What does it mean to you? And what does it mean to all of us? When I was in nursing school, there was a nursing theorist. Her name is Betty Newman. The theory was published in 1972 entitled A Model in Teaching Total Person Approach to Patients' Problems in Nursing Research. And in 1980, she published conceptual models for nursing practice. Betty Newman's basic assumptions are each client is unique, composite factors and characteristic within given range responses contained within a basic structure. She said a human being is a total person as a client, and the person is a layered with multi-dimensional being. Each layer consists of 5 person variables or subsystem. The first is physiological, refers to physiochemical structure and function of the body. The second is psychological, refers to mental processes and emotions. The third is sociocultural, refers to relationships, sociocultural expectations, and activities. The fourth is spiritual, refers to influence of spiritual beliefs. And lastly, developmental refers to those processes related to development over the lifespan. The healthcare profession is a unique profession concerned with all the variables that influence the response a person might have to stress or illness. As we celebrate the Vein Week, Rob, as we celebrate the Vein Week, we want to hear our panelists, their perception of care as a total person. So let me introduce our panelists. The first panelist, we have 2 students, Ms. Leanne Contreras. Ms. Contreras is currently a licensed nurse who is completing her bachelor's in nursing degree. The second one is Don Ngo, is a licensed nurse as well, completing his wound care certification classes. The third panelist is Richard Yap. Richard was one of my patients who had leg ulcers in the past. So Rob, do you want to address the questions to our panelists?
So just thinking a bit more about what Jennifer said there, to you as a nurse, what does treating the patient as a total person mean to you?
So thank you, Rob, for the question. So right now I am an LVN currently getting my wound care certification. So prior to getting more training in wound care, I was exposed to only simple wounds such as scrapes and scratches that requires simple dressings. However, as I go through the wound program, I am starting to see the different types of wounds which are more complicated, and it requires me, being the nurse, to look at more than the wound, but also to look at any problems with the patient themselves or the environment the patient is in that might need to be addressed in order for the wound to get better. In the early part of my training, I saw a patient with a wound care nurse that had a venous insufficiency wound, and this patient required compression as part of the treatment. The patient was telling the wound care nurse that he knows that compression will help him, but there are times that he just feels embarrassed to be seen with it, especially when he has people over, and that he feels bad for his wife, that she has to do more stuff around the house and drive him around because he has this problem. I guess it was at this patient that I realized that a wound not only affects the patient physically, but can also greatly affect them mentally and the people around them. You can say that as I learn more about the wounds, I am realizing that wounds have their own language, and if you pay attention close enough, you can hear them whisper in how you should treat them. Thank you, Rob.
And how about you, Leanne? What does treating the patient as a whole person mean to you?
You know, I'm also an LVN like Don, and I can agree with him. During my practice, there's really not a whole lot of wound care experience. I wasn't really, exposed to a whole lot of complicated wounds. But as I'm going through my RN program, what I'm really realizing, I mean, I'm not getting, a whole lot of wound exposure still, but what I'm gaining is a little bit more knowledge on how important it is to not really focus on just one aspect of a patient, because there are different factors in patient healing overall, whether it's a wound or, any other medical issue. I think that for those of us who don't deal so much with wound care, it's very easy to really overlook the other components that affect wound healing. We focus so much on, let's say, like the wound treatment and assessing for wound infection, but I think it's definitely more than skin deep. I have an experience just like Dawn. I had a patient that had a venous stasis ulcer, and that was also an eye opener for me. The patient had the wound on and off for years, and it was taking such a big toll on her. It was not only physically draining, but also emotionally draining, not only for the patient, but also for her family. So on top of just treating the wound, there were some psychological and emotional issues that I had to address as a nurse to make sure that the patient is motivated enough, to really understand and follow through with the plan of care, and that her support system is strong. To me personally, I think the term wound care is an understatement, because it's much more than just caring for the wound. It's truly caring for the whole person to get to that ultimate goal of wound healing.
Yeah, totally agree. And so, thinking of it from the patient's perspective then, Richard, what's your understanding or your experiences with being treated as a whole person?
Okay, I was thinking about that last night, how I'm going to approach this to talk about the patient's perspective. So I went on remembering when I start having the wound care from nurses going to the house and talking about the wound. As Lei said, it's not only the wound itself, it's the total aspect of the whole humanity that actually will involve with my feelings, with my family, with everybody. Especially, first of all, just like what Jennifer said, physiological. The wound really is painful. It's peripheral, neuropathy, pain, and everything. So with all of those things, I have anxiety. I don't really think very creative. I don't really think reasonable. All I want is to have my pain reduced. And with the nurses talking to me about it's expected, the expectation, it was very easy for me to accept the fact that there is pain and it can be healed. Second is the psychological aspect. As a person who knows about certain thing about wound, I feel so guilty. I have a doubt that my friends who are in the profession will say that I really did not care about myself, because it's infected, I keep scratching on it, it's getting more bigger wound, and the nurse is starting to have more problems with taking care of my wound. And I felt so depressed at the time, and I have the social innovations to actually involve my friends and my coworkers about the healing of my wound. I am so ashamed of the wound in the legs. It was a very nice leg before with a good skin contour. Now it's open with different kinds of, wounds. I really have to fight for that. And luckily, I know how to actually settle myself with depression. And with the help of Jennifer and the other nurses, I really made myself more stronger. It's really going to be very hard for patients who doesn't have any idea about the wound care healing. So it's a challenge for you guys, wound care people, wound care specialists, to really dig on what Jennifer is saying, the totality of the human being to be treated in wound care. And also, about what can I do as a patient? Do I need to change my activity of daily living? Do I need to change my diet? Do I need to do all of these things? It's really a very, very big burden to show to the nurses and to the wound care team that I participate in terms of healing the wound. Financially speaking, am I going to be working? Am I going to be on disability? Will I actually produce money to actually sustain my life? Those are the factors that's actually affecting maybe the wound healing, because the stress is within me. But with the help of a wound care team who is really have perseverance and have the ability to actually change the condition into a more human healing, I thank Jennifer that I had already a wound that's already closed, and I'm working now as normal, and I have no pain. And that's my experience as a patient with the wound. Thank you.
That's a really really good and kind of powerful description, and like you said, incorporating not only just the wound, but as Don and Leanne have mentioned, that all those other factors that can contribute and have an effect, and particularly recognizing that it's also an active process as well in terms of helping. It's not something that you're going to get the most benefit out of by being a passive process.
Thank you. Yeah.
Very well said, everybody. So, Rob, after hearing, all these comments from Leanne, Don, and Richard, I want to ask you, how do you apply it, in your practice as a physio, providing care as a total person?
So obviously, the population groups that I generally see, it's not as common that they will have wounds, but equally they can also sometimes, have wounds. But often what they're presenting with is pain, and it's something that's impacting on their daily function, their daily living, what they want to be able to do. And so in my practice, it's really important to trying to dig down and understand the person, understand all those factors that are contributing to that presentation, rather than just treating a symptom, because we know, particularly the pain science and the advances and developments in understanding pain, it's a really complex process. It's not just having tissue damage. As such, we can have no tissue damage but have pain, and how these other emotions, feelings, anxieties, all these can help to drive and contribute to a presentation. And so by just looking solely at the symptom of that, you're never going to be as effective and help to facilitate and promote some of that. Sometimes, which are often lifestyle changes, as Richard was saying, it's having that active process. Whereas in the past, physiotherapy, particularly in the UK, used to be seen a lot more as a passive intervention. Whereas particularly over the last kind of 10, 20 years, it's become much more of an active process where it's almost a partnership with the individual and the clinician, and trying to identify some of those barriers to sometimes change and understanding all their social aspects, their beliefs, their perceptions of what can happen with them, and trying to address all of those elements to help make a positive change and change their situation.
That is very good, Rob. Thank you, Rob.
And so how about you then, Jennifer, in your role as a nurse practitioner, how do you apply to applying care as a total person?
Rob and everybody, whenever I see my patients, I always look beyond my patients' bodies. What do I mean by that? Okay, patients with unhealthy veins, or even patients with leg ulcers, especially the ones with venous ulcers, can cause multiple problems. To give you an example is like weeping legs. That can cause malodorous discharge. And if because of that, the accumulation of these discharges can cause crusting. Not only crusting, but can have pain and edema. And all of this can cause social isolation. On the other hand, like what Richard said, this caused him to be depressed. So considering my background in psychiatry, I also see patients that their mental status is the cause of their open wounds on their legs. Because like Richard said something about that he picks his legs and skin. And, in my view, in my background in psychiatry, that can be caused by anxiety. And that can be related by anxiety. And to make it worse, if some of these patients have multiple comorbidities like diabetes, chronic venous insufficiency, or obesity, just to name a few, this can cause delay in wound healing. Therefore, as a clinician, we have to be very sensitive to the psychological impacts or psychological effects of the wounds, or psychological impacts to unhealthy veins on our patients. More so, we need to be very sensitive to how the individual psychological status will affect wound healing and in unhealthy veins. So that's about it for me, Rob. So
No, interesting.
yeah. So anything else that everybody wants, to share before we do our closing?
How about Jennifer? For example, you have a patient who actually have a very close affinity with the elders, and then we're talking about some using the the guava leaves to heal the wound or whatever. How do you actually approach them from being into that to the Western medicine? Yeah.
Also, you're talking about alternative type.
Alternative types.
Correct? Okay, all right. We, again, as clinicians, all of us, we have to be very culturally sensitive to our patients as well. So, what is really important for us is we have to educate our patients. We have to tell them, first of all, we have to assess and find out why they're doing that. So by asking that and then knowing the rationale for doing that, and that is the time you can intervene and tell them, the rationality of why you don't have to use them. Okay, because instead of making the wound heal, it can make the wound worse. But being so sensitive, culturally sensitive, being being very so sensitive and listening to your patients, I think will be very beneficial in the success of your plan of care in wounds.
Yes, I think so.
Any other additional information to that question? Rob, do you have anything that you can think of when it comes to cultural sensitive care as a total person?
It's it can be sometimes a challenging situation, and it's trying to get a good understanding, and like as was mentioned, utilizing their own social networks, their own friends, families, to come to consultations, appointments, and sometimes that can help to, aid with the buying and help to for an individual to be more open if they feel they're supported in their different networks. And so it's being adaptable as a clinician, from a clinician's point of view, isn't it? That changing our approach to each individual rather than a blanket approach. That isn't going to work for each person, because everybody's going to be unique in their presentation and their wounds and the way that they will require care.
Thank you, Rob. Thank you for that. Okay, so if there's nothing else, I want to do the closing right now. So getting from everybody's responses, I think, we all agree that caring for total person is very important. It's not too far from you, not too far from me. It's a real world. So a whole person care is something that brings together the health and the social services to our patients in order for us to build an integrated system that delivers seamless, coordinated care to our community. So that's the only thing I can say, and I've learned from all the responses that we put in this interview. So if there's nothing else, so thank you so much for joining Rob and myself. So Rob, maybe you want to tell them about, let's close this interview.
Yeah, well, I can just echo what Jennifer said there, and thank you all for your time. And it's been really interesting to get your different perspectives from different sides, as a clinician to a student, to, on the other side of being somebody who's receiving that care. And you've highlighted many kind of important aspects which need to be considered, treating the person as a whole.
Okay, so thank you, everybody. So let's do our vein week.
Thank you very much.
Thank you for the
Thank you for having us.
All right, thank you. So can we do our vein week, all of us? Come on, Rob, let's do this. It's kind of hard to do it, so wait a minute.
like this.
Yep.
Okay.
Thank you, everyone.
Thank you.